So how do you help somebody in mental health if they refuse to talk about the problem? This is a follow-up to the conversation about denial in therapy and the kinds of approaches we can use to work with it. This brings up a broader question though. Do you actually need insight in order to make change? Because certainly insight can be helpful, but I would suggest it's not necessary. Because humans don't understand what's going on around us all the time and yet still make positive change. I do agree, of course, that there has to be some interest in making some kind of change. But if you're showing up to therapy, that at least is the case, even if you're totally misunderstanding what the actual sort of issue is. I see this in couples all the time. Someone will show up and say, I'm here to help them be better. And I think we can all imagine how often that's actually true. But my experience has taught me that experiential learning, trying things out and doing things differently, matters more than actually understanding what the hell we're doing. I'm actually reminded of a great example when I was studying vision back in my neuroscience days. And there were experiments done on pilots when you asked, how do you look at all of these dials in this cockpit? And they said, well, I never look at one dial, I only look between them. But if you put an eye tracker on them, guess what you find? The only place they never look is between them. What they're actually doing is looking at each dial back and forth very quickly. But does it actually matter if they acknowledge that's what they're doing? No. What matters is the mental space that they need to be in order to do that task. And so allowing ourselves to have our alternate versions of reality can actually be very helpful, as long as they're not too far off and causing new problems. So how do you help somebody who refuses to talk about that problem? You talk about their view of the universe. You talk about their pain in the context of that worldview. And you focus on what will provide meaningful experiential knowledge rather than just the intellectual. And it's important to practice what you preach, meaning you approach your client with the humility of understanding that they've lived their life a lot longer than you have. And while you might share some of the knowledge you've learned in school or in practice, it doesn't mean 100% you're right anyway. And often the modeling of real humility alone can help them become a little bit more humble and curious about their worldview. And sometimes you both learn something together in that therapy room and discover neither of you were right. I hope that answers the question. If you got any others, throw them in the comments below as always. And don't forget to like and follow for more psychotherapy and neuro content.